managing diet, any part of diet management involves something which is called as medical nutritional therapy. People who are pre-diabetic might not need any kind of oral hypoglycemic agents or GLP inhibitors, just to make sure that their diabetes is managed. But that does not mean that they can eat whatever they want to. Your entire thing of lifestyle modifications and obesity factors and weight management factors revolves around 80% of your body, and your disease is managed the way you eat. So obviously, to begin with, how would I manage diabetes, for anyone? Just to put it plain and simple, I would incorporate complex carbohydrates. Diabetic people especially are really frightened, when we talk about carbohydrates, because anything which has excess of carbohydrate, my body is going to produce more glucose, and if there is insufficiency of insulin, obviously my sugar levels are going to go up, because the hormone, the security guard of my body is not functioning properly. So obviously it is going to end up in trouble ultimately. So complex carbohydrates are present in whole grains. They are, cereals are very good form of complex carbohydrates. And obviously we are going to encourage the use of low to moderate glycemic index foods, which I'm going to talk about in my later slide. But you need to encourage a more amount of foods. So for my patients, I just have a simple tagline where I say that eat from the earth, not from the boxes. The moment I'm picking up anything which has a processed thing, obviously the complex carbohydrate content is going to go low. So make some wise choices. It's not about what you need to restrict, or not. It's about eating in balance and making sure that you're making right choices to manage your disorder better. High biological value protein, I would definitely say yes, a big thumbs up to high biological proteins. Proteins are basically building blocks of body, and they're very important for growth, development, wear and tear, and also to a very larger extent they are responsible for the proper efficient functioning of insulin. So high biological proteins might be dairy products, low fat dairy products. You have pulses, you have eggs, you have chicken, you have fish, lean meats. These all are categorized as a good amount of protein content food. So make sure that you are saying yes to them, and you're taking in portions for sure. Fiber rich food, around 25 to 30 milligrams of fiber is grams of fiber is important for the basic management. In fiber rich foods increase the insulin sensitivity in the body. They help in weight management, because the feeling of satiety is always on a higher side if proteins and fiber are clubbed together in a meal. So it's very important to understand that fiber rich foods have to be included, and that is why I would still stick to the fact that the more processed products you take, the more you are sacrificing on the fiber content on it. Simple examples of fiber rich foods are like vegetables, fruits. They all have very good amount of fiber content. Whole grains are also a part of fiber content rich food. So make sure that you are saying yes to them, and you are just making sure that they are part of your wellness chart. Vitamins, very important. You have B vitamins, you have fat soluble, water soluble vitamins like B and C. You have fat soluble vitamins like A, D, E, K. All of them are abundantly available in your fruits, vegetables, and other products. So make sure that your vitamin content is definitely on a higher side, because in most cases we have seen that people who are on diabetic drugs are often low on their vitamin things. So when we take their blood samples, or when we ask for the blood screening, we have noticed that their vitamin levels are often on a lower side. Minerals are also very important for the management of diabetes. So basically, in and all, if I just want to put it up in one simple word, it has to be a balanced meal. So nothing more, nothing less. It just has to be personalized and customized based on your requirement. Water, 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 very important nutrient. Water is a universal solvent. It is responsible to transport various nutrients to various parts of the body. They help in weight management. They make your GI system more clear. They are universal solvents. So water is very important. I consider water as a very critical and important nutrient for diabetic management diet chart, for sure. Low sodium intake, very important. Sodium is basically salt. Okay, salt is something which is a white poison, and the more processed products I take, the more ready to eat packages I eat and entertain in my lifestyle, they are definitely going to not only affect my heart, but they are also going to make my diabetes management worse. So you need to make sure that your salt intake is like just bare. It is kept to just normal. In case if you're not hypertensive, but you have to make sure that you are not encouraging any external source of sodium in form of chips or packet products or biscuits or cookies, just to make sure that your low sodium intake will definitely help you for the better management of diabetes.
So what should be a typical diet plate then?
And this is how a diet plate looks like. We have those diet tools in our clinic where we show people, our patients, our potential diabetic patients, to make sure that this is how it goes, and it should actually look like a CD. A CD, what you use. It should be around 9 inches plate. And this is how you need to place your meal. So if you notice this, half of my 9-inch plate is filled with fruits, vegetables. So definitely around 50% of your total calorie intake should be encouraged, from fruits, vegetables, to make sure that I am able to give vitamins, minerals, fiber, everything from that. If I want to go to the second half of the plate, second half, the 1/4 side would be cereals. So basically it has to be loaded with carbohydrate, good carbohydrates. There are two types of carbohydrates: simple, complex. Go for complex. It's a no-brainer. You need to go for complex carbohydrates, just fill in your stomach, and you should do good with diabetes. This is very important part. We need to understand, all the diabetics need to make sure that your plate should look something like this, just to make sure that your diabetes is not giving you any troubles with sugar management. Carbohydrate means, of course, 1/4 of my plate goes to carbohydrate, which is very important. It's a primary fuel of energy. Even diabetics have to eat good amount of carbohydrates in portions suitable to their body for the better management. Carbohydrates are very important for your body. They are extremely important because they're the primary source of fuel what your body uses for energy. So please do not eliminate carbohydrate thinking that it's bad for diabetes, but it's very important that what kind of carbohydrates you take and how much do you take. That really matters. And rest 1/4 is proteins. I mentioned earlier that proteins are extremely critical for wear and tear of your cells and for the better functioning of insulin. So obviously you need to fill up your plate with good amount of lean proteins, high biological proteins like eggs. You have tofu, you have soy, you have non-veg sources. You have dairy products which are low fat. So this is how an ideal diabetic plate looks like. I would definitely insist a lot on things with any kind of diabetes. If you really want to make your lifestyle changes to be sustainable, I would say go slow, make healthy choices, and strike a balance somewhere. So when I'm saying no to them, it's something where if you can curtail them completely, great. If you cannot curtail them completely in your diet, alcohol is something which is like, gives you empty calories. Okay. It is not very body friendly for any body functions. In fact, most of the type 2 diabetes patients, especially, they need to lose weight. So they have a lot of insulin resistance. And because it's an empty calorie is nothing, it does not give me any nutritional benefit. So my body is not benefiting from it, even after its consumption. So alcohol, 1 gram of alcohol gives me around 7 kilocalories, and that is something where it's a waste. It's like satisfying to my mind, maybe, but it's not helping my body or manage my sugar levels better. So definitely alcohol is something which has to be curtailed. If at all you need to consume alcohol, you need to make sure that you are not going beyond one drink, for females especially, and will be on 2 drinks for males. But alcohol, in any case, it's a wise choice to just eliminate them and put them under red zone. uh, Sweet and refined products, yes, very important. I mentioned in my earlier slides that I have spoken about a lot of refined products and processed products. Sweets, obviously, for simple reasons that they will definitely bring about sugar spikes, and they just come crashing down anytime. So they make you feel good, and there is a huge surge later. So it's very important to curtail them, make them as occasional treats. You can use some sweet substitutes, which are better choices, but you need to make sure that you're not staying away from such high sugary stuff. Red meats, yes, you need to eliminate red meats also, for the obvious reason they also hamper your cholesterol level, especially LDL cholesterol, which is a low density lipoprotein. It's a bad cholesterol. It's called bad cholesterol, and most of the diabetics have dyslipidemia. Basically, their lipid profile is also messed up completely. So it's better. Sodium, I have already spoken about sodium rich things. Sodium basically, it is not only good for your heart, but overall for diabetes management, it slows down the progression and the better management of diabetes. So it's better that you are definitely not taking sodium rich foods. You're eliminating them. Please check the nutrition label, before you actually take any choices, because 1 gram of salt gives you around 2300 milligrams of sodium. So please, information on the nutrition label is extremely important. Caffeine are something where you get it in tea, coffee. Okay, caffeine is not very bad, but yes, it is. I can categorize caffeine within the limits. So you need to make sure that if you're including caffeine, which is in form of tea or coffee, I would say at the next 2 to 3 cups, because around 1 cup of coffee gives you conveniently around 90 to 100 milligrams of caffeine. So technically 300 milligrams of caffeine, that's it, per day consumption is the maximum limit I can set in. Caffeine, it's best, if you're not so addicted to coffee or tea, it's best to eliminate them, because they are also diuretics. So they interfere with the absorption of your diabetic medicines as well. Heavy meals, thumb rule of any diabetic, because I want to prevent insulin, your sugars, surges. I have to ensure that I am giving in portions. If you develop into a pattern of eating 5-6 meal pattern per day, where you're breaking your calories into small units, it is definitely a very effective treatment to manage your diabetes better. Heavy meals give a lot of competition to your poor insulin resistance, where it is already struggling with its basic function. So it is definitely very taxing on your digestive system, which takes around 80% of your total energy. And it's not a very good idea to make sure that you are feeding your body with a larger meal portions, because that is something which is not good for your sugar levels. It's not good for your digestion too. And diabetics often have some GI related issues, especially with digestion. So it's very important to consider that you're breaking your meals, under the supervision of a diet expert, to make sure that your sugar level are constant, and of course your glucose levels are also steady throughout. And fried stuff, not to say, because as I mentioned earlier, that once the diabetes enter your body, it definitely gives you a lot of complications with your heart and your cholesterol profile and your lipid profiles and your kidney profiles. So fried foods, of course, you need to just go slow on them, and obviously fried stuff will make your meals heavy. At the same time, they will contribute to extra uh, calories what your body does not need. One of the principles of managing diabetes well is a calorie deficit diet, especially for obese individuals. As I mentioned earlier, that they are into the category of losing some fat, around 10 to 20% of their body weight is excess than the normal ideal body weight. So fried stuff would anyways not help. Definitely all these things can be taken as an occasional treat, but you have to kind of remember that they are not going to help you in any ways. They might mentally be very fulfilling, but physically they are of no use to your body. Functional foods are basically foods which help in they have a specific component which help in a better insulin response. So these things are abundantly available, they are locally available as well. So the functionality of these things is they have a specific active components in them which help and which have a very positive impact on your insulin levels. When you want to probably increase the insulin sensitivity, which you want, any diabetic would want to increase insulin sensitivity. These all things have to be a part of your diet. Fenugreek seeds, excellent source of beta glucan, which helps, which has a very positive impact on your cholesterol levels. They have a fantastic response on your diabetic control, especially your fasting sugar levels. So definitely fenugreek seeds have to be a part of any. You can also use some fenugreek powders. You can encourage some soak seeds, soak them overnight and consume them next morning. But yes, please make sure that they are the part of these things. Functional foods, no food in isolation can actually, I can't pinpoint on one particular thing, which will help you to manage your sugar levels steady. But these all things combinedly with a lifestyle modification plan works wonder. Turmeric, again, curcumin in turmeric helps in increasing the insulin response. So please include, and it's very popularly used in Indian cuisine. So turmeric is something which you need to use it. Cinnamon, again, one kind of functional food which really helps in bringing your sugar levels down and also improving your lipid profile. Soya, isoflavones in soya and its products. You can go for some pre-harvested soya. You can go for some bean curd, which is called tofu. You can go for roasted soybeans as a part of it. Tomatoes has a very powerful antioxidant lycopene, which helps in proper management of it, and also it's considered to be a low GI food. So it's a big yes for tomatoes should be a part of a diabetic meal plan. Probiotics, when I say probiotics, are basically fermented products. You have curd, you have fermented products, you have kefir. These all are wonderful probiotics. Why probiotic is functional food and helps in better insulin response is insulin sensitivity is increased because your most of the diabetic, as I mentioned earlier, are having some sort of GI issues. This keeps your gut healthy. It's an irony that most of the problems, the occurrence of most of the health issues is from your gut, poor gut health. So probiotics helps to fix that, and thus in exchange it also increases insulin sensitivity. And fiber, as I mentioned earlier, helps in weight management, makes your sugar levels more steady in your body. At the same time, it also helps in cholesterol management.
So let's quickly go through some of the tips that you will tell our viewers.
So the first thing is definitely there is a myth that diabetes cannot eat fruits, because it has sugar. Every fruit has sugar, fructose. Basically, it's called fruit sugar. Or however, that's not true. The wonderful dosage of vitamins and minerals what your body desperately needs to manage your sugar levels better is obtained from fruits. Major chunk of it is obtained from fruits. Obviously, you need to curtail fruit juices because they are sweetened. You need to add some extra table sugar to it, or maybe you just strain them. So important fibers are anyways lost. So obviously, you don't need to encourage usage of fruit juices, but fruits can be taken definitely in portions. Every food you eat has an impact on your sugar levels except water. So obviously your healthcare provider is the best person to help you out with this. You need to have balanced diet, as you can just correlate it with your diabetic plate. You need to have fibrous fruits and vegetables. By now we know that why fiber is so important. Protein rich meals are very important. You need to go slow on your junk food and ready to eat processed products. Take them as occasional treat, just to make sure that your junk food consumption is to bare minimum. Dinner should be around 3 hours before bedtime. It's very important to maintain timings. With diabetes, there are three principles: portion control, timings, and most importantly, the spacing of the meals. If you are able to get all three factors in your meal chart, you are sorted with your diabetic plan. Exercising, as I mentioned earlier, 150 minutes per week is very important. Any form of physical activity is important, at least 5 times a week. Regular foot care, in India, here, it's a part of diabetes management. Foot, because diabetic patients have a very sensitive foot, so you have to take care of their diabetes. You need to take a screening for foot care at least annually, just to make sure that everything is like okay. Especially when you have diabetes detected 5 years before, so you need to make sure retina scans and fundus examination, because obviously microvascular complication or is retinopathy, and your eyes are really affected because of uncontrolled sugar levels. So foot care, retina scans, are very important part of a medical protocol, and they should be taken annually.